Hey everybody, welcome to CalmEffect's webinar today. Today we'll begin talking about the benefits of CBD for stress, anxiety, sleeping, and joint pain. Glad you could join us. All right, so who are we? CalmEffect is really an education company. We believe that medical marijuana and CBD should be more affordable and accessible for everybody. We found that it's tough to understand the process. States are fragmented. It's tough to find inexpensive opportunities with doctors and CBD and dispensaries. And so we're trying to help people understand what's available, how to go about doing it, and where to go for the product. My name is Scott. I'm joined by George. We've been with the company. I've been with the company almost 3 years now. For me, this is really important to learn about CBD because I dealt with OCD for my whole life and wasn't diagnosed with it. And so if there's something out there that people can take that is natural, it's an alternative to an addictive pharmaceutical, or to help you so you don't have to deal with your pain or anxiety, we want to make sure that people have the option to at least consider the product and services. Whereas for the last 9 or 10 decades, it's been illegal. Now that it is legal, we believe people should have opportunities to seek out this natural medicine to see if it's right for them. George, you want to introduce yourself?
Sure. My name is George. I've been with CalmEffect about a little over a year. My personal experience with CBD, I take it for my lower back pain. I've had back pain, I'd say, about since the end of high school. I was a wrestler in high school. I've been weightlifting. I play sports a lot. Been in and out of physical therapy. And chiropractors, never really found a good solution, just very temporary solutions. I started taking CBD, I'd say about a year ago. I'd taken liquid CBD drops under my tongue. And the differences are very significant in terms of my pain. I take it specifically for my lower back pain at night to help me sleep, because that's when I'd feel the most pain. And the difference is amazing. It really is. It's helped my sleep quality and my back pain at night.
It's interesting you say that, George. I tweaked my back a few days ago, and I was in so much pain that I had trouble, standing up. And I took some CBD. I've been taking CBD, and I increased the milligrams that I was taking. And really, the next day, I felt really, really good. And I was shocked because the last time I hurt my back this way, based upon that, I thought I was going to be in pain for months. And with this quarantine going on, I couldn't understand how I was going to be able to survive. And to take the CBD, I don't know if it was all the CBD, but that's the one thing that I did differently. And the next day I felt really good. And the day after that, I didn't feel anything. So I don't know if it could do that for everybody, but I'm a believer as well.
Right. And that's my case as well. The CBD was the only thing I did differently. So, I attribute it to that. About a week after I started taking it, I noticed the effects. So.
Yeah, great. All right, cool. Well, we're looking forward to talking to everybody about this. So a word from the lawyers. As you know, marijuana has been legal for decades. We're not doctors, we're not lawyers. And because it's been illegal for decades and now legal in most states, marijuana is legal in, I think it's about 33 states, CBD in most states. But there hasn't really been scientific research, the appropriate research like what pharmaceuticals do with their medications to really be able to make claims about CBD. And so we want to make sure that we don't say that it can cure X or it will certainly help, Y. What we know is that people are reporting that they're feeling better on this stuff. George and I are good examples of that, and we'll talk about some more examples at the end. But the FDA has not reviewed these statements, and any CBD products that you might find over the counter online or somewhere else that says that CBD can do X, Y, Z it's not compliant. And so you should question that about why people feel that they need to say that. Again, we believe it helps. We've been using it, and others are as well. Like medical marijuana, it's so new, and hopefully there'll be studies going on so everybody's comfortable making statements about it. But we want to make sure that you have the information so that you can make the best judgment for yourself and potentially try it and see if it works for you. At the end of this presentation, there will be a special offer. At the end of the presentation, we know you're interested in CBD, so we've put together a special deal for everybody who attends, and we'll go into that at the end. All right, George, take it away.
So let's just start out real quick. Let's talk about what CBD is. So CBD is short for cannabidiol, and it is one of the many cannabinoids that are produced by the cannabis family. The other, more popular, is THC, which I'm sure you've heard of. It's the primary psychoactive element in marijuana that's responsible for the euphoria feeling, the quote-unquote high feeling, where CBD is non-psychoactive, meaning it doesn't have a euphoric feeling or produce a high feeling on cognitive brain activity. And CBD can actually be found in both the hemp and the cannabis plant. And CBD from hemp is much more likely to not have THC because the hemp is the marijuana plant without the actual buds on it, the flower buds that contain the THC. So a lot of people ask, how do you take it? What are the routes of administration? And there are quite a few now that they have. There's liquid drops that you can place under your tongue. They have gummies. I know they have vapor. I'm sure you guys have seen the vapor pens. They have CBD vapor cartridges. And another thing that's interesting, I know some dispensaries actually will have CBD flower. They've actually figured out a way to grow buds of flower that have very high CBD quality and very low THC. So there are many ways to take it. Each has their own onset and half-life. Just for example, things that you ingest, like gummies or liquid, might take a little bit longer to hit you, but do build up over time. For example, after you start taking the liquid for about a week, you'll start to notice the effects. Whereas a vapor pen, you get that calm feeling more instantly, but it lasts less in your system.
And one of the things, George, I'd add is if you're having trouble sleeping through the night, one way to take it might be through a capsule or an oil under the tongue, because that lasts longer each time you take it, as opposed to if you have a flare-up of chronic pain or something like that, you might vape it or smoke it so it hits you quicker, but it's going to leave you quicker.
Faster acting, right, but lasts not as long.
That's right. And the other thing I'd add is, we're so early in this process of legalizing CBD and marijuana, and we have no idea what it's going to look like in 5 years. We all expect everything to be totally legal federally. It's not a matter of if, but when. It's not going to be this year. But what does the marketplace look like? You're already starting to see, CBD beverages on the West Coast and other types of CBD products. We don't see those in Florida yet, or in most of the medical states, but as the states become more adult use, you see, kind of a mushrooming of different types of products that people might use to relieve their pain.
Yeah, and speaking of, one I forgot to mention is a topical cream that you can just rub directly on your skin too. That's also available. So
yeah.
All right. So what can CBD be used to treat? What symptoms or conditions can CBD be beneficial for? So let's get into that. The first we'll talk about is epilepsy, which is a seizure disorder. So in 2017, there's a clinical trial that was published by the New England Journal of Medicine, and it found that CBD was actually highly effective in reducing seizures with people suffering from Dravet syndrome, which is actually a rare form of epilepsy, which causes seizures. And then another study that took place a year prior involved 214 participants that were suffering from epilepsy. So they were given anywhere from 0.9 to 2.3 grams of CBD oil per each pound of their total body weight. And the results indicated that the participants experienced seizures at a significantly reduced median of 36.5%. So it significantly reduced the rate at which they experienced seizures from taking CBD oil. Next is anxiety and depression. The World Health Organization has actually reported that depression is the single largest contributor to disability worldwide, while anxiety is sixth. So since they're so common and so commonly seen, these are usually treated with pharmaceutical drugs, which can cause an array of side effects such as dizziness, allergic reactions, insomnia, headaches, and can, of course, some of them could also cause addiction and physical dependence. And data actually shows that CBD oil has promise as potential treatment for both depression and anxiety as an alternative form to pharmaceuticals. So in a recent study, there were 57 men that participated, and they were either given an oral CBD or a placebo 90 minutes before undergoing a public speaking test. And the researchers actually found that the 300 milligram dose of CBD was significant at reducing anxiety in the participants. Further research actually shows that CBD can also be used to treat insomnia and anxiety, which are associated with post-traumatic stress disorder, or PTSD, in children. It also has been shown that it has antidepressant effects, which has been shown in several animal studies. And it's believed that they have these antidepressant-like effects because CBD is linked to, it acts on the brain's receptors for serotonin, which is our neurotransmitter that actually regulates our mood, our social behavior, and things of that nature. Another one, which I actually spoke a little bit about earlier, is chronic pain, nerve and joint pain. Studies have shown that CBD can reduce this chronic pain due to the fact that it impacts our endocannabinoid receptor activity. And that interaction causes reduced inflammation while it interacts with our neurotransmitters. Just for example, they have done some rat studies and found that CBD injections reduced pain to surgical incisions among rats, and that was pretty recent in 2017. And then a previous study found that oral CBD treatment in rats significantly reduced the sciatic nerve pain and inflammation. Next, let's talk about multiple sclerosis, or MS. CBD has been shown that it can be effective in treating that, potentially. There has been a recent study with 47 participants with MS were taking oral CBD for about a period of a month, and the results of that study actually indicated that participants significant improvements in their pain when walking, at rest, and their muscle spasms. And that was pretty recent in 2015. A previous study also shows that CBD oral spray, which is like a liquid CBD spray that could just be drops or just drops in a spray form. Participants took that, and the results indicated that it was able to significantly reduce pain during movement and rest, as well as overall sleep quality in 58 people with rheumatoid arthritis. And then a later study actually found that oral liquid CBD reduced spasms in 75% of the 276 participants who were suffering with MS that were experiencing muscle spasms that were not able to be treated with a common medication. Next is cancer-related symptoms. So CBD has also been shown to be effective in potentially treating some symptoms associated with cancer and cancer treatment, like chemotherapy. Those symptoms include nausea, vomiting, and the chronic pain associated with cancer and treatment. And a study in 2009 actually examined these effects of CBD and THC. So that they used a blend of THC and CBD. Remember, THC is the psychoactive component, where CBD is the non-psychoactive. So they used a blend in cancer patients who didn't receive relief from their medication, and found that those who took the blend, the CBD and THC, experienced significant reduction in pain in comparison to a group that was just given THC. So when they added the CBD blend with the THC, it was much more effective at alleviating pain. And then a study of 16 people undergoing chemo found that a one-to-one combination of THC and CBD, which is a blend, they call it a blend of CBD and THC, was administered via mouth, and it was significantly successful at reducing their vomiting and nausea, better than the standalone treatment.
Hey George, if I could also add, I think one of the themes is that CBD and THC could potentially help with some of the symptoms with some of these conditions that we're talking about.
Absolutely.
Anybody out, so it's like nausea, pain, insomnia. Anybody who is, saying that some of these products can cure some of the underlying causes of some of these conditions, that's a tough statement to make. To my knowledge, there's no data that says that it can cure X, Y, Z.
Absolutely.
In fact, it's awful that some people are saying that that CBD and THC can help COVID virus right now, and the FDA is cracking down on a bunch of companies that are doing that, and there's no data that shows that.
No, it's certainly not a cure. for anything, but it
Yeah,
definitely can be a alternative source of treatment. There is potential in it.
that's right. To help you feel better and get more relief.
Yes, absolutely. And in addition to what we just talked about, those symptoms and conditions, there has been some research on CBD being used to treat substance abuse, so like alcoholism and drug addiction. It's also been shown to assist in diabetes prevention and also been shown to have anti-tumor effects as well, although more research is needed in these areas. So another common question is, are there any side effects to CBD? And let's get into that right now. So are there any side effects? It is rare, but just like anything else, any other supplement or alternative medicine you take, there could be some side effects. These can just include dry mouth, diarrhea, reduced appetite, fatigue, and drowsiness. Some interactions, a lot of people ask, are there any interactions with medications I'm currently taking with CBD? Is it safe? CBD, it can interact with some types of medications, specifically blood thinners or any drugs or supplements or medications you take that directly impact metabolism. And to add to that, anything really with a grapefruit warning specifically, interestingly enough, because both grapefruit and CBD both interfere with our cytochromes, which are groups of enzymes that are crucial to drug metabolism.
All right, so again, don't forget about the disclaimer. We're not lawyers and we're not doctors, and that the FDA still really needs to do in-depth studies in order for us to be able to make claims, and for anybody else to make claims. Anybody who's not transparent about that is really is not being compliant and probably isn't a service provider that you should purchase CBD from. That said, there are a lot of people who are reporting that they're having success with it. We like CBDMD's product because they're one of the bigger players. They have rigorous testing on their products, and a lot of athletes are using their products. So people like Kerry Walsh Jennings, who's a professional beach volleyball player, uses it for her sleep. Bubba Watson uses it to help him feel better. They have a bunch of other football players that use it. Gronk uses CBD. Now, Gronk's everywhere, and he took a lot of hits when he was playing football, as you know. He's saying now that he wished that, he had been able to use CBD while he was playing. On that note, a lot of major league sports teams are now considering or in discussions about what to do about CBD and marijuana, and are talking about potentially relaxing sanctions against the players. Some aren't even testing for marijuana now at certain points of the season, because they know that it can help people, and they also don't want their players addicted to, pharmaceutical painkillers, which a lot of people are reporting. And in recent news, with coronavirus, Chris Cuomo from CNN has reported that he's using CBD for pain and sleep as he's fighting COVID-19, 2020. So, we look forward to hearing from Chris about his experiences with that. But, he's in rough shape, and we wish him better. And there are many others who are using it as well. Some of the resources to get more information on CBD, you can go to CalmEffect.com, which has a variety of information on CBD. Our sister company, MindandBodyImprovements.com, also has information on ways that you can begin feeling better, and has a store for CBD. Like I mentioned, we use the CBD MD products right now. We really like the quality of them. That's the product I use. We have gummies for them, and oils and lotions. So feel free to browse that website if you're interested. And on that note, the prize for everybody for sticking with us through the webinar is that we're offering 10% off the entire order today. That's in addition to the low prices that are lower than retail on that website. So if you use the coupon code webinar10, you'll be able to access that 10% discount. So we'll leave that up while we answer some questions. Let me take a look at the question area. If you have questions, please feel free to ask those questions in the Q&A. We'd be happy to answer them for you, or afterwards you can email info@calmeffect.com, or info@Mind and Body Improvements. George, one question is, is it okay to buy CBD online, or should you get it in a store? You have any thoughts on that?
I mean, it's absolutely okay to buy it online. Just I would definitely do your research on the company and the reputability of the product and the brand first.
Yeah, I agree with that, George. I think that unfortunately, everybody is peddling CBD nowadays, which was right. It was very difficult for us to try to understand what CBD that we should carry on our websites. We wanted to make sure that there was a CBD that we could stand behind for our customers and patients. And so, CBD MD is one example. They're traded on the stock exchange. They, like I said, they have the athletes. They have the data reports that show you what's in the CBD as well as what's not in the CBD. You want to make sure that there's no, metals in there or pesticides, and you can't get that kind of significant testing if it's, if you're buying it from your friend Joe, or it's being sold at a gas station, right? I think some of the CBD stores sell a variety of stuff, but they're closed right now. So it's, I think you just want to use your due diligence and think hard before you buy from a person or a company. Just think about it and look for references like you would anything else. Is CBD a fad, George? Oh, looks like we lost George for some reason, so I'll answer that question. I don't think so. I think that more and more acceleration of people who are interested in CBD is coming, and I believe that more tests will be done so that ultimately it'll become legal federally, just like I believe marijuana will be legal federally at some point. I think that states have to go through their processes, and we want to make sure that everything is safe for people and it's not being used illegally once it is legalized. But I think that it won't be a fad, and we'll see more consistent testing and more quality products. We have a question, where to go to get a prescription for CBD. That's a great question, and CBD with THC. So as George mentioned earlier, CBD can be found in both the hemp plant as well as the cannabis plant. So, it's in both plants, but in the cannabis plant, there's THC. And so CBD, if it has less than 0.3%, is legal over the counter. Technically, you don't need a prescription for it or have to see a medical doctor to get that prescription. They call it technically a recommendation in the industry. And so you can technically get that CBD, over the counter at a Whole Foods, at a gas station, mindandbodyimprovements.com, or other websites. Now, if it has THC, that is still very regulated by the states. So even if it's legal, you'd have to get it at a legal dispensary. In medical marijuana states, you'd have to get it at a dispensary that's authorized to sell THC and CBD together at one of the dispensaries to people who have their medical card. So you'd have to, you can go to CalmEffect, and we help people find inexpensive doctors and understand the process, so you can go about getting your medical card there. Hopefully that answers your question. That's a great question, thank you. Other questions? All right, well, don't forget to visit mindandbodyimprovements.com to qualify for your discounts. And you can email info@CalmEffect or info@mindandbodyimprovements. We'd be happy to answer your questions. Thank you so much for joining our webinar today. We hope it was informative for you. Please let your friends know about it, and we look forward to speaking with you down the line. Thanks a lot. Bye.